We have a very important message today to get out to the public. That message is that vaccines are safe, they're effective, and we can prevent an increased number of deaths from COVID-19. There is still time. People can still get vaccinated. I would encourage everybody that is not vaccinated to go out and talk with their primary care doctor or find a location that can give you the shot.
Evidence shows that COVID-19 is now really a pandemic of the unvaccinated. In New Mexico, 93% of hospitalizations for COVID-19 are in the unvaccinated. In Presbyterian hospitals statewide, we're experiencing a doubling of cases every week.
Every patient with COVID-19 that is in the hospital is taking up the spot of another patient with a cancer or a stroke or some other illness that needs care. At UNM Hospital, we are seeing increasing number of COVID-19 patients, and we have been catching up with deferred care, with trauma care, and with stroke care, and our hospital has been very full for several months. This time around, we are not starting at a place where we have a lot of capacity, but we are also starting at a place where we have a very effective weapon against this virus. I think it is important for people to realize that less than 0.01% of fully vaccinated people have been hospitalized this time around.
Here at TriCore, we are seeing increasing positivity rate for COVID-19. We are also seeing increased number of tests being performed. Right now, it is critical that people who have symptoms are going to be tested so that we can prevent the spread of the virus within the community. Just want to reassure everyone that the tests that are performed at TriCore are able to effectively detect the Delta variant, and there is no cross-reactivity with other viruses that would cause any other false positive results. The tests that we are performing here are highly sensitive, they're highly specific, and they're our best way to know who may have the virus and our best way to know who needs to be isolated until they're no longer infectious to others.
When we first started seeing patients 15 months ago, there was a spread, but it tended to be people with underlying medical conditions just because it was harder for them to compensate for reacting to the infection itself. And so a little bit older, a little bit sicker with chronic conditions. And now what we're seeing is that it's the people who aren't getting vaccinated. And so that demographic tends to be younger people, not necessarily with medical problems, because maybe there's a sense that they're invincible and that COVID won't get them because it didn't get them already.
I think what this latest surge has shown us, that is, if you're not vaccinated and if you allow the virus to spread, it will mutate. And if we continue to stay unvaccinated, we are faced with the possibility of an even more dangerous mutant in the future. So the longer we stay unvaccinated, the more opportunity we are giving the virus to mutate again. And we already know that there are other mutants on the horizon that we have started to study.